Gandhi Super Specialty Hospital, Raichur, Institute of Medical Sciences, Raichur, and he is the head of the Department of Cardiology. He has done his MBBS degree from the very prestigious Karnataka Medical College, Hubli, affiliated with Karnataka University, Dharwad, then in 1988. Then he pursued his MD General Medicine from the prestigious Postgraduate Institute of Medical Education and Research, Chandigarh. After that, Doctor has completed his DM in cardiology from the King George Medical College, Lucknow. After his completion of his academics, he has worked as a consultant cardiologist in Kailash Hospital, Noida, then Care Hospital, Hyderabad, later in Rajiv Gandhi Hospital, Raichur, which was managed then by Apollo Group of Institutes. And in fact, it is a matter of pride to inform that Dr. Sagarad is a first trained interventional cardiologist of Kalyana, Karnataka area. Congratulations, Doctor. And it's a matter of pride for all of us. Now, Doctor is serving cardiac patients independently since 2001 with his clinical acumen and interventional skills. He has procedural experience in both non-invasive and invasive cardiology. Since 2013, he is working in RGSSH Super Specialty Unit of Raichur Institute of Medical Sciences, Raichur, as faculty. Dr. Sagarad is actively involved in academic teaching activities, and he is also teaching undergraduates and postgraduate students in medical college, and he is guide to postgraduate students pursuing MD in medicine. Dr. Sagarad has published his original research works in national and in journals of national and international repute. He is an associate editor of APIK Journal of Internal Medicine, which is an indexed journal and published by API Karnataka through Walter Kluwer Magno. Dr. Sagarad has been recognized by many national and international associations, and he has received fellowships from prestigious institutes like European Society of Cardiology, Cardiological Society of India, Association of Physicians of India, Indian Academy of Echocardiography, Indian College of Cardiology, and recently, very prestigious Royal College of Physicians and Surgeons of Glasgow has recognized Dr. On organizational front, he has served as President of Cardiological Society of India, Karnataka chapter, President of Indian Medical Association, Raichur branch, and he is currently Chairman-elect of API Karnataka and working committee member of the Indian Medical Association, Karnataka State branch. He has authored many books like World Heart Day Update, Heart to Heart, Living with Diabetes, ಮತ್ತು ಕನ್ನಡದಲ್ಲೂ ಸಹ ಹಲವಾರು ಪುಸ್ತಕಗಳನ್ನ ಡಾಕ್ಟರ್ ಬರೆದಿದ್ದಾರೆ. ಅವುಗಳಲ್ಲಿ ಮುಖ್ಯವಾದವು ಹೃದಯದಿಂದ ಹೃದಯಕ್ಕಾಗಿ, ಮಧುಮೇಹ ಜೀವನ ಸಂಗಾತಿ, ರಕ್ತದಾನ ಜೀವದಾನ, ಅಂಗದಾನ, ಆಮೇಲೆ ಹೃದಯ ಆರೋಗ್ಯ ಮತ್ತು ಅರಿವು, ಬಸವನ ಕಂಡಿರ ವಚನಗಳು, ತೀರ ಎಳೆಯ ಬಾರೋ ಇದೊಂದು ಕವನ ಸಂಕಲನ, ವೈದ್ಯ ಸಂಪದ ಪತ್ರಿಕೆಯ ಪ್ರಧಾನ ಸಂಪಾದಕರಾಗಿಯೂ ಸಹ ಕಾರ್ಯನಿರ್ವಹಿಸ್ತಾ ಇದ್ದಾರೆ. ಮೆಡಿಕಲ್ ಫೀಲ್ಡ್ ಅಲ್ಲದೆ ಸಾಹಿತ್ಯ ಕ್ಷೇತ್ರದಲ್ಲೂ ಛಾಪು ಮೂಡಿಸಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಸುರೇಶ್ ಸಗರದ್ ಅವರು ಇಂದು ನಮ್ಮ ಹಲವಾರು ಕೆಲಸ ಕಾರ್ಯಗಳ ನಡುವೆ ಕಾರ್ಡಿಯಕ್ ಕೇರ್ ಬಗ್ಗೆ ಎರಡು ಉಪನ್ಯಾಸ ನೀಡ್ತಾರೆ. ಇವತ್ತು ಮೊದಲನೇದು 27ನೇ ತಾರೀಕು, ಆ ನಂತರ 29ಕ್ಕೂ ಸಹ ಮತ್ತೊಂದು ಉಪನ್ಯಾಸ ನೀಡಿದ್ದಾರೆ. ಇವತ್ತು ಬೇಸಿಕ್ಸ್ ಆಫ್ ಅನಾಟಮಿ ಅಂಡ್ ಫಿಸಿಯಾಲಜಿ ಆಫ್ ಕಾರ್ಡಿಯಾಲಜಿ ಹಾರ್ಟ್ ಬಗ್ಗೆ ಉಪನ್ಯಾಸವನ್ನ ನೀಡ್ತಾರೆ. ಈ ಒಂದು ಸಂಕ್ಷಿಪ್ತವಾಗಿ ಅವರ ದೂರವನ್ನು ಹೇಳಿದ್ದೇನೆ. ಈಗ now, Professor, I request you to take over and deliver your talk on cardiac anatomy and physiology. Now over to you, sir.
Thank you, sir. Thank you very much for that kind introduction. So I am honored and privileged to be with you today. So I think they're all students mainly.
Yes, sir. Yes, sir. Students.
So
Uh,
it's a very important topic because
Doctor, just a moment. Former Vice Chancellor of Dharwad, Karnataka University, Professor S.K. Saidapur is also has joined.
okay.
It is a matter of pride for this talk, sir. Welcome to you, sir. Saidapur, sir. Now, what do you, sir? ನಿಮಗೆ what do you, Dr. Sagarad, sir?
Sir, thank you. Thank you. So today we will be discussing about cardiac anatomy and cardiac physiology. So as you all know, heart is a very important organ in human body. And just like how we use a pump in home, heart also functions like a pump in the body. So we all know that the body requires nutrients and oxygen and a lot of other things to survive, all the cells. So body needs flow of blood, and that blood will be supplying all the requirements to the tissues. So for this you need continuous pumping of this blood to all the parts of the body. So heart, which is a very important organ, and just like in our home, how a pump works, like that only. Similarly, this heart way is working in our body, and as you all know, its function is very essential to survival of human being. If your heart is functioning, that means you are alive. If your heart is not functioning, means the man is dead. So that is how now the importance of heart lies in our life. And it's very important to know how heart is made up of, and how heart functions. Today we'll discuss some of the issues concerned with that topic. We will not go into very complex issues of anatomy or physiology, which students who will pursue subsequently medicine will study in detail. But at PUC level, what is required for you people will discuss. And as you all aware, nowadays the problems with heart, you must have heard heart attacks, sudden death. Of late, with the advent of social media, daily we see a lot of messages that somebody has died suddenly, somebody has collapsed while doing the gym, somebody has died in the sports arena, or so those kind of things you will be hearing. So for that also, we have to prevent such kind of catastrophe in future generation. For that also, we need to understand what are the problems surrounding heart, so that we can prevent, and whatever the future generation which you people are going to become are healthy, strong, and you will contribute to the building of society and nation in general. So for that sake of interest also, we need to know what are the anatomical features, what are the physiological features of the heart, and how the things change in our body over a period of time, and what are the pathological changes which occur, and how they can be prevented. So today we will discuss only anatomy and physiology part of it, and day after tomorrow on 29th Wednesday, we will discuss about pathological aspects of the heart, and how to prevent catastrophes in our day-to-day life. So you all know, you can see this video that heart is doing its function, it is contracting and relaxing. So this is how heart is functioning in our body. This is the echocardiography picture of the heart functioning. So just to make you interesting, I put this first slide. We'll again come back to this slide later. So we'll move to the very important aspect. See, uh, heart starts functioning not just after the birth. You may think only after birth heart starts beating. That is not true. Actually, when baby is in the mother's womb, that is when it is in the uterus. So by the time it becomes 6 weeks old, heart is developed within the fetus, and a very small tiny heart will be functioning. So by 6 weeks of conception, heart starts functioning, and it continues to beat. And after the delivery, you can hear the heartbeats, and you can appreciate the heartbeats. And then till death, it continues to beat, continues to beat, continues to beat. Imagine a person who has a heart beating in the range of around 60 to 80. Usually we take it as 70 beats per minute. And in 24 hours, how many times it will beat? In 1 year, how many times it will beat? And over a lifetime, how many times it can beat? Suppose if you take an average lifetime of 70 years, it is estimated that it will beat 2.5 billion times continuously. So there is no rest for the heart. So it can beat 2.5 billion times. So God has created such a wonderful organ in our body. So this heart is where it is situated. We all know that it is situated in the chest. So you can see in this diagram, there is a central position. You can see the heart, and it is slightly projecting towards left side. So it is directed towards left side of the chest, in the middle portion of the chest or thorax, and it is surrounded by two lungs either side, right and left. You can see the lungs are there on the adjacent side, and you can see the both the lungs, and this is the heart which is situated in the center of the thorax, and it is directed towards the left. So you can see this, the size is actually, usually we say it as, if you make a fist from your left hand, the left fist size is usually the size of the individual's heart. So you can just imagine how much is size of your heart. So this is situated in the what we call it as mediastinum. So behind the sternum, so in between the two lungs, this heart is situated. So this is the position of the normal heart. Sometimes you may come across that somebody's heart is on the right side. So that is called dextrocardia. So sometimes when we do scanning, or sometimes when we do X-rays, we can see that is 1 in 1 lakh or 1 in 2 lakh population. We may see heart on right side, but generally it is in the center, directed towards the left side. That's why you call it as levocardia. So so that is the position of the heart. So during anatomy, we should know where the heart is situated. So once we know the heart, the size, I said it is a left fist. If you take the dimensions, so it's about, they say about 12 centimeter long, and about 9 centimeter wide, and about 6 centimeter in breadth. So 12 by 9 by 6 we can take as an average. So the weight is about, on an average, it is about 250 grams, slightly lower in ladies, females, and it is slightly higher on males, because men are more muscular. So the heart size or heart weight is also larger in males. So around 300 grams you can say in males, and about 200 grams in females. On an average, we can say about 250 grams it weighs. So this is the gross where it is situated, and what are the dimensions. So we know that this is how a heart looks. So what exactly it is made up of, heart? So most of you people have already studied in your biology class that heart is made up of four chambers, two upper chambers and two lower chambers. So the two upper chambers are called as atrium. So one is on the right side, that is called right atrium. Another is on the left side, that is called left atrium. And the below chambers or lower chambers are called ventricles. So right side, right ventricle, and left side, it is left ventricle. So when you see the heart from the front or anterior view, or from the straight in front of chest, then it will look like whatever what has been shown in this diagram. So you can see this is the right atrium, this is the left atrium because it is left side. Then this is the right ventricle and this is the left ventricle. So this is the from when you see from outside. So this is not the cut structure, but it is from outside. When you see, this will look like this. So I can show one of the uh, model which I am holding here. So it is almost similar to that. So you can see that my focus, I am focusing here. So this is how it looks. So similar to that picture which has been shown. So this is a three-dimensional object which I am holding. So this is, you can imagine. So this is again the same picture which I show, that is not labeled, but this is labeled. So which I was talking about, this is called the, you have the right side, this is the upper chamber, this is called the right atrium. This is on the left side, the upper chamber, it is called the left atrium. And this is the ventricle, lower chamber, which is called the left. This is on the right side, so it's the right ventricle. And this side, this is the left ventricle. So you can see one great vessel which is coming out from the right ventricle. This is called the pulmonary artery. And there is a red vessel which is coming out from the left ventricle. It is called the main blood vessel. That is called as aorta. So this is the red large vessel. It's called aorta. And there is a blue large vessel which is coming from the right side, right ventricle. This is called pulmonary artery or pulmonary trunk. So this is how the outer surface of the heart looks like. So this is when you see from straight forward. So this is again the same picture with some more representation. So you can again same, there is a right side and left side. You have a right ventricle, left ventricle, then the right atrium, left atrium. Then there are some blood vessels which are running on the surface of the heart. You can see this will I'll tell in the next discussion what are these. So these are the blood vessels which are running, and you can see the blue, the large vessel, it is a pulmonary artery. And you have a left large vessel that is called aorta. And this is called there is a blue vessel, this is called superior vena cava. And there is a one muscle which is coming from the lower part of the body, that is lower limbs. So this is called inferior vena cava. So you can see there is a difference between right and left. Why this right and left is marked? Because we know that we have blood in the heart, isn't it? So there is a oxygenated blood and there is a deoxygenated blood. So oxygenated blood is in the left side and deoxygenated blood is in the right side. So whatever oxygenated blood, it will look like a red blood. So that's why the left atrium, left ventricle, and the aorta which is arising from this, they will be labeled as left with red, while the right side is filled with the blood which comes from the body. So that will be deoxygenated blood which lacks oxygen. So that blood will be bluish. So that's why it is labeled in a blue color. There is pulmonary trunk, the superior vena cava, the inferior vena cava, and the right side of the body is labeled as right blue. So this is the you can see the heart from behind. If you stand behind the back of an individual and see how heart looks from back. So this is, you can see there is a blue structures which I was talking about, that is superior vena cava and the inferior vena cava. Then we have, there are blood vessels which are marked with blue and red, and there are four blood vessels here. So these are called as pulmonary veins. I will come to that later. And I showed the blue vessel, that is the pulmonary trunk, which divides into right pulmonary artery and left pulmonary artery. So we'll again discuss in cross section. So when you open the heart, what is inside the heart. So we are talking about 4 chambers in the heart. We label them as right atrium, left atrium, right ventricle, and left ventricle. So when you take a section of the heart, when you divide heart into 2 parts, then you can see what is inside the heart. So you can see the chambers here. See, this is one chamber here, there is one chamber here, and one chamber here, and one chamber here. So this is on the right side. This is the upper chamber. It is called right atrium. And this is the lower chamber. This is the ventricle. This is on the right side. This is right ventricle. And this is the left upper chamber. This is the left atrium. And then you have a lower chamber. This is called left ventricle. So how blood circulates within the heart, that we can see here. See, the blood is coming here. This is the left atrium. So from left atrium, it enters the left ventricle, and then from left ventricle, it goes through this red large blood vessel, that is aorta. So this is how oxygenated blood from left atrium, it comes to left ventricle. From then it goes to left atria, aorta. From aorta, it goes to different parts of the body. So these are the blood vessels. These are the blood vessels which supply blood to body. So if you calculate the amount of blood vessels which are in the body, it has been estimated that there is a 120 kilometer length of blood vessels which are present within a human body. So this is the left side. Then you have right-sided blood, that is deoxygenated blood, which I was telling. So this is the right atrium. From there, it comes into right ventricle. From that right ventricle, it goes into pulmonary artery. So this is a deoxygenated blood, which is in the right side. So you see this pulmonary artery, which I was telling, this is the blue large vessel. From this, blood goes to lungs. So you all know that when the blood enters the lungs, there takes place exchange of oxygen and carbon dioxide. So carbon dioxide goes out in the lungs while oxygen is taken into the blood. So there is a purification of the blood in the lungs. So once that purification occurs, the deoxygenated blood becomes oxygenated blood in the lung capillaries. From the lungs, it comes back to left side of the heart. You can see here there are two blood vessels which are here, red blood vessels, small, this side and this side. So these are called pulmonary veins. Actually, these take blood from lungs and they brought into the left atrium. So they pour that blood into the left atrium. So from lungs through the pulmonary veins, this deoxygenated blood will come to left atrium. From there, it goes to left ventricle, then through the aorta to the body. So once it reaches the different parts of the body, there again, the oxygen and carbon dioxide exchange will take place. So tissues will take up oxygen from the blood, and because of metabolic activity, there is production of carbon dioxide. So that carbon dioxide enters the blood. So that blood, which is the deoxygenated blood, it has to come back to the heart. So it comes back through the veins. So you can see one blue here and another blue here. This is called the from the upper part of the body, superior vena cava, the blood enters, while from lower part of the body, inferior vena cava, blood enters the right atrium. So now the deoxygenated blood comes to right atrium, then it goes to right ventricle, then it goes through the pulmonary artery, it goes to the lungs. So this is how the circulation happens in our body. Now you can see when the blood is moving from atrium to ventricle, there is something which you can see. There is something. And also from left atrium, when it comes to left ventricle, there is a gate-like structure. You can imagine, you can see this. There is a one gate here and there is a one gate here. And from left to right ventricle, when it goes to right ventricle, there is a one gate here. And also from left ventricle to aorta, when blood enters, there is a gate here. So there is, just like in our house, how we have doors to control the movement, like that there are doors in the heart. So there are 4 doors actually. They are called valves. So there between left atrium and left ventricle, there is one valve. This is called the mitral valve. Then from left ventricle to aorta, there is one more valve that is called aortic valve. And from right side, we have from between right atrium and right ventricle, there is one valve which is called as tricuspid valve. And from right ventricle to the pulmonary artery, there is one more valve. It is called pulmonary valve. So there are four valves in the heart which control the blood flow across the heart. There is these valves. The function of the valve is it will allow only one direction of the blood flow. From left atrium, the blood can enter into left ventricle. From left ventricle, blood can enter into aorta. So this is regulated. There is a unidirectional flow so that there is no back leaking. Because of these valves, the blood doesn't come back. It has to go forward. Just also same on the right side. From right atrium, it has to come into the right ventricle. From right ventricle, it has to go into pulmonary artery. So these valves, these four valves, which are across the chambers and the chambers in the great arteries, they will regulate the blood flow in one direction so that blood doesn't gets back when there is a contraction and relaxation. So that is the importance of the valves. So you can see the cut section of the uh, heart in another diagram here. So this is the right atrium. This lower side is the right ventricle. This is the left ventricle. And above you have a left atrium. Then you can see there is a valve here. There is a valve here. So there is a valve here. So these valves will control the blood flow in one direction. So now you can also see there is a right ventricle and there is a left ventricle. You have a left side, you have oxygenated blood, and on right side you have deoxygenated blood. So they are adjacent to each other. So there should not be any mixing of this blood. So to prevent that, there is a septum which actually separates. You can see here between ventricles, there is a muscle tissue which is called interventricular septum. So which will separate right ventricle from left ventricle so that there is no mixing of deoxygenated and oxygenated blood. So they run separately. The blood runs separately without mixing in the heart because of interventricular septum. And also between the atria, right atrium and left atrium, there is a septum so that there is no mixing of the blood vessel. So blood. So this is called interatrial septum and this is called interventricular septum. So the blood will not mix oxygenated and deoxygenated blood, and also there is unidirectional blood flow. So sometimes during development, there may be problem in the development of the interventricular septum. So there may be a hole in this interventricular septum. That time, left and right blood may mix. And also in the interatrial septum, there may be hole in the during the development. If there is no proper development, then there may be mixing. So you can sometimes doctors might have told that there is a hole in the heart to that baby or child. So that is because developmentally there may be problem in the development of these interventricular septum or interatrial septum. So there may be because of that the holes will form and blood from right side will mix with left side and left side blood will mix from right side. So during development there should not be any abnormalities so that there will not be problems like that. So now we have studied about what is the position of the heart, what are the dimensions of the heart, and what are the chambers of the heart, what is the right side and left side, and what are the functions of the valves, and what is the function of interatrial septum and interventricular septum, and how the blood flow is happening in the heart. So this I have told. So you can see in this again in this cross section. You see this blood is coming from the right atrium to right ventricle. This is the tricuspid valve, and then blood goes into the pulmonary artery. Here you can see there is one valve is called pulmonary valve, which will control the blood flow into the pulmonary artery. Similarly, you have left atrium here. The blood actually comes into the left ventricle through this valve. This is called the mitral valve. So then blood is ejected into the aorta through the one more valve here. This is the aortic valve. So there is a unidirectional blood flow, and also because of this intraventricular septum and intraarterial septum, there is no mixing of the heart blood. So we'll slightly know about different chambers which we have discussed now, because what is happening in those chambers we'll come to know. So this is the left atrium. You can see this is the area where this is the left upper chamber. This is the left atrial chamber, and I had told you that there will be 4 vessels which actually open into this left atrium. These are called pulmonary veins. So these actually pulmonary veins, they actually take blood from the lungs, and then they pour this blood into the left atrium, so that the left atrium receives oxygenated blood, and then from left atrium it actually pumps the blood into left ventricle. So, so left atrium, again one more cut section I can show you here. So this is the left atrium. You can see this is a smooth chamber, and there are 4 veins, which pulmonary veins, which will be opening into this chamber. This is the oxygenated blood. This is the left side, and then when it contracts, actually the blood is poured into the left ventricle. So that is about left atrium. And right atrium, this is on the right side, right upper chamber, and this is also similar to the left atrium. So it actually receives blood from the, I told there is a vena cava, superior vena cava, which actually receives blood from the upper part of the body. And this is a deoxygenated blood. This comes to the right side. And also from the lower part of the body, this is called inferior vena cava. So this will be coming, this blood, deoxygenated blood in the right atrium. From the right atrium to right ventricle, across the tricuspid valve, blood will flow. So this is another cut section, how it actually looks when you open the right atrium, when you cut open. So this is actually, this is the intraarterial septum, which we are seeing from the cut section. So similarly, we have 2 lower chambers, that is the left ventricle. You can see this is the chamber of the left ventricle. This is the chamber of the right ventricle. Normally, left ventricle is larger than right ventricle in the body, because this is the dominant ventricle, and it actually pumps the blood to whole part of the body. That's why it is on the larger side. You can see the muscle mass here. Muscle, it's actually almost 3 times that of the right side. So this is a small chamber. You can see this is the large chamber. The left ventricle will be generally larger than the right ventricle. Similarly, you can see the cut section of the left ventricle and right ventricle. So this is the left atrium. This is the tricuspid, this one mitral valve. Then you have right side. This is a smaller chamber. You can compare left and right. Right is smaller, and the right atrium. This is the left atrium. This is in between. You can see this is one more muscle mass. This is the interventricular septum. So left ventricle and right ventricle. So similarly, right ventricle, again you can see in this chamber. This is the lower chamber. This is the right sided right ventricle. This is the tricuspid valve, and superior is the, we have right atrium. So from blood it enters the right ventricle. So that is about chambers: left atrium, right atrium, left ventricle, right ventricle. So generally left ventricle is the dominant ventricle, which is large, and it is more smaller chamber. So I was talking about valves in the heart. So to control or regulate the blood flow in one direction, there are valves. I had told there are 4 valves in the heart. So you can see 1 year, 1 year, 1 year and 1 year. So there are 4 valves actually. So this is mitral valve. This is the left sided. So this mitral valve is actually between left atrium and left ventricle. In between left atrium and left ventricle, this is the mitral valve. And then on the right side, it is called tricuspid valve. So this is between right atrium and right ventricle. So this is called tricuspid because there are 3 cusps, 1, 2, 3. And this mitral is called because it looks like parachute when you see it from the down. And there are 2 other valves which I told. One is called aortic valve, another is called pulmonary valve. So this aortic valve is left ventricle and aorta. In between, this is the aortic valve. And we have the 4th valve that is called pulmonary valve. So this pulmonary valve is between right ventricle and pulmonary artery. So these are the valves which actually control. So you can see different, this is the aortic valve. When it is open, it will look like this. When it is closed, it will look like this. This has got a 3 cusps and it closes like this, and it opens like this. So this is the cut section of the aortic valve. You can see here. So this is the left ventricle and here is the aorta. So in between aorta and left ventricle, we have a aortic valve which actually controls the blood flow. So blood flow occurs from left ventricle to aorta only. So there should not be reverse flow because of aortic valve. So these are again different cut sections. So this is aortic valve, which is between left ventricle and aorta. And the tricuspid valve, which I was talking about, this is between right atrium and right ventricle because it has got 3 cusps. It's called tricuspid valve. So the blood flows from right atrium to right ventricle because of tricuspid valve. And the another valve is pulmonary valve. What I was telling, pulmonary valve is between right ventricle and pulmonary artery. So from pulmonary right ventricle, blood is ejected into the pulmonary artery in one direction. So this also has got 3 cusps and it's called semilunar valve. So basically, you should understand that there is a mitral valve, there is a tricuspid valve, there is a aortic valve, there is a pulmonary valve. So there are 4 valves, there are 4 chambers in the heart. Now, we know that what is the function of the heart? So heart basically does pumping. So when it does pumping, so blood is pumped into the circulation. That is the blood vessels which arise from the heart. So this when it pumps, so for that it requires energy. So for that energy, it requires the muscle actually requires oxygen. So it cannot directly take oxygen from the blood within the chamber. So for that, what has been done is just like our body receives oxygen from the blood vessels. Similarly, even the heart muscle also receives oxygen from small blood vessels within the heart. So these are called coronary arteries. So these are very important arteries. You can see here there is a one artery on this side and one artery on this side. So this is called left coronary artery and this is called right coronary artery. So these coronary arteries actually supply blood to muscles of the heart. So about whatever oxygen which is required for the muscles of the heart is supplied by these coronary arteries. So these are very important arteries. You might have heard that somebody had a heart attack, somebody collapsed because of fall in blood pressure. You might have heard. So that occurs because whenever there is a problem in this coronary arteries, so these coronary arteries, if they are blocked, then there will not be blood flow to the muscles of the heart. So they will there will be lack of oxygen to these muscles. So because of that, heart attack will occur. That we'll discuss on Wednesday and 29th. So what are the causes of that blockade within these coronary arteries, and why heart attack occurs, and how we can prevent heart attack subsequently, what are the causes, and how to manage. So you can see these are the coronary arteries, the red which are moving. So these are the blood vessels which actually supply blood to the muscles of the heart. So this is the left coronary artery, this is the right coronary artery. So they will supply oxygen to the muscles of the heart. These are very important arteries which needs to be protected all the time. So we have discussed about what are the chambers in the heart, what are the valves which actually control the this one, and also how the muscle is supplied with coronary arteries. So these are the three aspects which we have discussed. And the another thing is just like we have a pump in the house. So to operate that pump, we need electricity. So that electricity will be converted into mechanical energy, and then the pumping occurs in the home. Just like that, see, when to heart to pump, that means it has muscle. So that muscle has to contract and muscle has to relax. So for that contraction to occur, relaxation to occur, it requires a electrical stimulation. So electrical stimulation, just like we have a wiring system in the house or home, similarly, there is a electrical wiring system within the heart, which actually produces small electrical impulses and stimulate the heart muscle. And once there is a stimulation of the heart muscle, then heart muscle will contract. So there is a electrical impulses which will be generated and transmitted to the muscle, so that muscle contracts and relax, and that is called conduction system in the heart. It is actually a wiring system. You can see here there is a wiring system which you can appreciate within the heart. So actually the impulse, that electrical impulse has to be generated. So that generator is situated, and it's called as sinoatrial node. So this is the SA node, which where exactly the impulse will be generated. This is situated in the right atrium. So right atrial muscle, it will be situated. Once this impulse is generated here, and this will be transmitted across the right atrium and across the left atrium. So from SA node, that impulse will come down, and this is called atrioventricular node, AV node. From this AV node, this is called is bundle of is, and then it goes to right ventricle from the right bundle, and then it goes to left ventricle through the left bundle. So there is a wiring system within the heart where electrical impulse will be generated from SA node, AV node, bundle of is, then right bundle, then the left bundle, and then it will be dividing into small electrical network that is called Purkinje system, is Purkinje system. So there is a beautiful electrical network is there in the heart, so that whatever mechanical activity happens in the heart is actually triggered and controlled or regulated by the electrical system. So we have a electrical network, it is called as conduction system. So we normally say heartbeat about 70 per minute. So this is the SA node actually, which triggers impulses at a rate of 70 per minute, and then the heart beats at a rate of 70 per minute. You can sometimes, when you do exercise, when you run around, your heartbeat will be on higher side. It may go to 110, 120, 130. So that is because SA node will be sensitive to whatever is happening in the body. So whenever there is a requirement is on higher side, then it also sends impulses at a higher rate. When suppose if you are sleeping where the demand is less, the normal heart rate, which is during awake, it is around 70. When you sleep, the heart rate may fall down to 60 or 50. So that time heart rate will be on lower side. So SA node will be discharging at a rate of 50 to 60 when we are sleeping. But the same SA node, when a person exerts or exercises, it start sending impulses at a higher rate. So there is a mechanism within the heart that the contractility as well as the heart rate are regulated as per the demand of the heart and person. So this is how the electrical system is working. So you can see one more picture here. From SA node, the impulse goes to AV node. From bundle of His, it goes to right side and left side of the heart. So this is the conduction system which is beautifully working in the heart. So we have valves, we have electrical network, we have different chambers within the heart. So these electrical system which we are discussing, so how whether it can be analyzed how the heart is working, so that is done by, it's called ECG, electrocardiogram or electrocardiography. So we can record whatever electrical activity is happening within the heart through this machine. So this is called ECG, that is in short term, or we can call it as electrocardiogram or electrocardiography, that recording. So whatever electrical activity which is happening, whether it is normally happening or it is abnormally happening, so those can be tested by this machine. So this was invented almost 100 years back. So this we are using very regularly to monitor the patient. Now coming to the actual cut section of the heart, we have discussed only chambers, electrical system and the valves. But actually the cut section when you do, we know that this is the pumping organ. So the pumping is happening because of muscle. So once the muscle contracts and relax, the contraction and relaxation, the pumping happens. So that is because of muscle. So where, see, we have in the body, we have muscles of different kinds. So if you want to lift an object, you have to contract muscles of your hands or upper limb. So if you want to kick a ball, then your lower limb leg muscles will be contracting. So when you walk, your lower limb leg muscles will contract and relax. So that's how the movement occurs. Similarly, like that, we have in the heart, that is called myocardium. That is the most important part of the heart, which actually exerts the pressure and creates pressure so that the pumping occurs. You can see here, see, this is the muscle mass. So you can take a cut section of this area. So how it looks, this is the main muscle, this is called the myocardium. There is a one layer of cell which is adjacent to the myocardium, which is actually facing the chamber. So this is called endocardium. So because it is inside, it is called endocardium. And this is the muscle main mass, this is in the middle. So this is called myocardium. And then the heart is covered by a layer, so that is called pericardium. That means it is covering the heart, pericardium. So we have three layers in the heart. One is the outer layer, which actually does a protective function so that there will not be friction with the adjacent organs. So there is a pericardium which actually protects the heart from the surrounding tissues, and size is also maintained. And then we have a middle part, it is called the muscle mainly. So that is the contracting element. So that is the myocardium. So which actually contracts and relax. And there is one more layer within the inside, so which is facing the chamber. So this is called endocardium. So we have three layers in the cut section: endocardium, myocardium and pericardium. So there will be three layers when you do the cut section of the heart. So this is the blood circulation which actually happens in the body, which I have already once where I have discussed it with you people. See, this is the left side of the heart. This is shown as red. So this is the, this actually carrying the oxygenated blood. So from left atrium across the mitral valve, blood enters the left ventricle. Then when left ventricle contracts, it pumps or ejects blood into the aorta across the aortic wall. Then through aorta and its branches, so blood, oxygenated blood goes to the different parts of the body. So these are the tissues. So these large vessel, it goes on branching, branching and branching, just like the main canal which starts at the dam, it gives on giving the branches. So like that, a large blood vessel like aorta, it goes on dividing, branching, and becomes small. So these smaller vessels are called as arteries, and then they are called smaller arterioles. Then it becomes very thin and small. They are called as capillaries. So due in the capillaries, these blood, the exchange occurs because tissues, because of metabolism, there will be production of metabolic waste, as well as there is a production of carbon dioxide. So that enters the capillaries, while the blood within the capillaries, which are actually carrying oxygen, actually it enters the tissue. So there is exchange which occurs in the capillaries. Then the deoxygenated blood, again it starts coming back through the venous system. So the small veins are called venules, and then the larger ones will be called veins. So from the veins, the deoxygenated blue blood actually comes back. So it comes back into the right side of the heart. This is called right, it enters the right atrium. So from the upper part of the body, superior vena cava drains the blood into the right atrium, while from the lower part of the body, inferior vena cava drains the blood into the right atrium. So once it reaches the right atrium, this is the deoxygenated blood. Across the tricuspid valve, it enters the right ventricle. Then from right ventricle, across the pulmonary valve, it goes into pulmonary artery. From pulmonary artery, you can see here, it actually now reaching the lungs. So here again, it divides, and then becomes small capillaries. So in the capillaries, again there is a exchange of gases. So we know that the carbon dioxide is high in the venous blood, blue blood. So this carbon dioxide gets into the alveoli, and the oxygen which is available in the alveoli, in the lungs, it actually enters the capillary blood. So now there is a purification has happened in the purification has taken place in the lungs. So once there is a purification, these capillaries again join, and they become a bigger vessels. So this now it has become, you can see the red. So these are called pulmonary veins. So these pulmonary veins, there will be four pulmonary veins, actually two from right side, two from left side. They come and join the left atrium. So the left atrium now receives the oxygenated blood from the left atrium. Across the mitral wall, it enters the left ventricle. From left ventricle, across the aortic wall, it goes into aorta. So this is how continuously it is happening in the human body. You just imagine, at each pumping of the left ventricle, around 70 ml of blood is ejected into the aorta with each beat. So imagine about 70 beats per minute. So about 5 liter of blood is pumped into the aorta every minute. So nearly 14,000 liters of blood is pumped every day by our heart. You can imagine in 70 years how much it will be pumping blood continuously without any rest. So which is highly impossible with the machines also. So heart is a very important organ, doing this meticulous work continuously till the end of life. So that's how circulation happens. So now we have uh, discussed about anatomy and physiological aspects of the heart. So how we can see this heart with different modalities? You know, earlier era there was no technology, isn't it? So people used to see the heart when they were doing some surgeries. When you open the chest and you can see the live heart beating, and how the chambers are there, and what is happening. That is one way of studying the anatomy and physiology of the heart. And then the other modalities where you study the hearts of different organisms. You know, when we are in PUC and MBBS, we used to dissect the frog and see the frog heart, how it is functioning. And different animals were dissected, and also the heart used to be seen. And of course, in cadavers, we actually, during our medical learning, the first MBBS, we do dissection. cadaver, the dead bodies we dissect and cut open the body and see the heart, and also we dissect the heart and see the different layers and what are the chambers, and all those things are studied. So earlier era, when there was no technology which was available, so people used to study in cadavers how things are happening. But now with the advent of the technology, so there are many things which are available now. See, about 100 years back when x-rays were detected, so we started doing x-ray of the chest. So during when you do x-ray of the chest, you can see the silhouette of the heart, but we cannot assess the what is happening there, but at least we used to see the picture of the heart which I showed you. So subsequently, now for last about 20-30 years back, we developed ultrasound machines. So ultrasound machines, in those machines, we actually generate ultrasounds and then send it across the body. So these ultrasounds, when they travel across the body, some part of it is observed, some part of it is reflected back. So whatever is reflected back is analyzed by the computer and it converts it into images, and those images can be studied. And also like ultrasound, now we have different technologies like CT scan and MRI. So magnetic resonance imaging is also one of the technology where we can you can see this picture. See, this is the MRI of the heart. So you can beautifully see how the heart is contracting and how the blood is actually moving from chamber to the major blood vessel. You can see even the uh, see, this is the chamber, and this is the blood which is moving out, and here is a valve which is actually opening and closing, and then it is going into the trunk. So this is beautifully you can see, and these are the blood vessels, aorta and pulmonary arteries. So with MRIL we can actually see what is happening in the heart. These are the technologies which have developed. So those who are interested in medicine and biotechnology will be exposed to these technologies. Students will be so another important technology which I was talking was ultrasonography, or it's also called as echocardiogram. So basically it is the ultrasound of the heart. So you can see here is a cross section of the heart, which is a cadaveric model. So this is the left ventricle, this is the right ventricle, this is the interventricular septum, and this is the valve, this is the atrium, this is the aorta. So you can see here, this is the ultrasound scan, which actually show the different parts of the heart. This picture is depicting this what I have shown. So you can this is the left ventricle, and this is the atrium, this is the mitral wall, this is the aorta here. So we can actually see how the things are happening. So this you can see, this is the one of the structure of the heart. And when you do echocardiography or the ultrasound of the heart, we can actually see this is the left atrium, this is the left ventricle, this is the mitral wall, this is the right atrium, this is the right capsule wall, this is the right ventricle, interatrial septum and interventricular septum. So beautifully we can see how the heart actually looks. So echocardiography has made things more easier for us, so that whatever problems which are occurring in the heart, we can actually know how the chambers are functioning, how they are contracting, and whether there is any damage to the heart, and how the blood flow is happening, whether it's unidirectional or there is some leakage is happening. So those things can be now understood by this. Is one more picture you can see the beautifully we can compare with a picture with the this ultrasound picture or echocardiography picture we can compare. And this is the echocardiography picture. Today only I have taken one of the patients. So you can see here, this is the left ventricle, right ventricle. This is the mitral wall. This is the left atrium. This is the right atrium. And you can see the interventricular septum here and this interatrial septum. So a beautiful picture of the cut section of the heart can be generated with echocardiography machines. So this is, you can see how, how the functioning is happening. You can see the you can see here, this is the, which is actually contracting. See, it is contracting. So there is a, here you can see there is something which is moving. This is actually the valve which is actually regulating the flow. So this is the left atrium, left ventricle, and this is the mitral wall. Here is the aortic wall. This is the aorta. So how you can see how it is actually, this is the contraction and relaxation of the heart can be made out from the echocardiography machine. So the anatomy of the heart as well as the physiology of the heart can be studied with this machine. So this is one more section. You can see I have taken section like this. So one was like this cross section, another is the round section. So you can see the heart is, this is pumping like this. So you can see that. So inside there is a valve also. So the heart is contracting and relaxing in a circular manner. So there is a circular cut of the heart. So this is the four chamber view. You can see how the heart is, the contracting like this. So in the previous film, it was like circular. So that was like this. Now it is like this, how it is contracting. So this is the anatomical and physiological aspects of the heart, which can be studied with the currently available machines. So now you can see that there is a color inside. So it is called color Doppler. So how blood is moving inside the heart, that can be actually depicted in a color or a graphical way. So the red which is moving and there is a blue which is going away. So from left atrium, blood moves into the left ventricle. From left ventricle, blue blood goes out into the aorta. So that can be tracked, and we can also quantify how much blood is moving from one chamber to other chamber and from other chamber to great arteries. That can be also calculated. So we can calculate what is the pressure inside the heart, how much is blood is being pumped. So we call it as stroke volume, cardiac output. So those things can also be measured by the currently available echocardiography machines. So this is about cardiac anatomy and cardiac physiology. So if there are any questions, we'll take up and discuss. So I just kept it simple. I have not gone into complex histological issues or electrophysiological issues. So this is only, we should know that there are four chambers in the heart. They are called atrium and ventricle, and there is a left side of the heart and right side of the heart. There is oxygenated blood, then the deoxygenated blood. They will not be mixed, and the blood has to flow in one direction. So there are valves to control it, and then this mechanical activity of the contraction is controlled by a conduction system, that is the electrical network which is there. And also this muscle requires oxygen, so that oxygen is supplied by small arteries. They are called as coronary arteries. This is the simplified cardiac anatomy and cardiac physiology. We will take up any questions are there.
Dr. Suresh sir, it was in fact very in simple words you explained how heart works, which everybody should know, including students and general public. And I'm sure many students would have understood the functioning of the heart very well with your very good explanation. Yeah, really, it is amazing to know that heart beats 2.5 billion times till the age of 70 years. And there are 1,20,000 kilometer blood vessels. Really amazing. I'm sure many students would not have, even me, I was not aware, I have forgotten. In fact, it's a recap of what we had studied some 25, 30 years ago in our PU. It was like a recap, Doctor. Thank you very much. for a very scholastic and informative talk in a very simple, easily understandable way. Explained. Thank you very much on behalf of KSTA and all those who are present for this webinar, both on Cisco WebEx and YouTube platform. Now we have with us zoology expert, former Vice Chancellor of Karnataka University, Professor S.K. Saidapur sir is there. He is a Shanti Sarup Bhatnagar awardee, and he was also the member of Karnataka Science and Technology Academy. Sir, over to you for your comments.
Thank you. First of all, I don't have any comments. It was an excellent talk, and I'm very happy to listen to him. He is also alumni of KUD because he said at that time KMC was under Karnataka University.
Yes, sir.
And, yeah, so I'm very happy to hear this wonderful lecture. I have a couple of small clarification I want, for which the answer can be yes or no. For example, whether echocardiograph can reveal blocks in the heart, presence or absence of blocks.
Actually, we doesn't use echocardiography to analyze the blood vessels. They are actually very small, 3 to 5 millimeter. So
Yeah.
it doesn't use.
Yeah.
So for that, we use coronary angiography. So angiography is the gold standard to know about the blocks in those coronary arteries.
Yeah.
So echocardiography is mainly used to see whether there is a damage has occurred or not. If there is a heart attack, then that part which is dead is not contracting. So that can be seen in the echocardiography. But generally, we doesn't use it to evaluate the block. That has been done by the coronary angiography.
So angiography is a bit invasive technique. How is it?
There are two modalities. Nowadays, we are doing with CT scan also. That's called CT coronary angio.
Okay.
So there it will not be invasive. It is just like doing a CT scan. We inject contrast agent and take the films, just like photographs. So it will not be, there is no admissions, and we just like you get a CT scan of the other organs, it will be done. So that is called, that is non-invasive.
Any side effects for that? Any side effects for that?
Side effects, sir?
Yeah.
Side effects is same because
Side effects
we use
of CT scanning with the
CT
dye
scan.
injected.
CT scan uses one radiation.
No,
So
but
radiation
also
has
injecting some dye, no?
Yeah, I'll come to that. There are two aspects. One is per se CT scan. So there will be radiation hazard to the patients who are undergoing the CT scan. And second is we use contrast agent. So these contrast agents can produce allergic reactions, one, and they can do damage to the kidneys also. So we have to be careful when we are giving. Similarly, in invasive also we use contrast agent. So there also that problem will be there.
Thank you so much.
Sir.
And now for students, shall I just add a couple of sentences?
Yes,
Yes,
sir.
sir.
Please.
Quite often students think that the cardiovascular system is for transporting oxygen and carbon dioxide. Just want to tell them that the blood also is concerned with the transporting variety of substances in the body. Is like, for example, all minerals, electrolytes, sugars, proteins, hormones, name anything, everything has to go through the blood to the tissues and then back from tissues to the wherever they have to be disposed of. So it is not just, quite often as students, we always think whole system, that the cardiovascular system is for oxygen transport, but it also does variety of other things which are equally important. And name any substance, it will be found in the blood that is there in the body. Excretory products, waste products, useful things, everything is there. Plus, there are blood cells in the blood plasma, which have their own problems of maintaining homeostasis. There are other challenging issues. So many things are there. That whole thing is a very interesting subject. And Dr. Suresh Sagarad had done it so appear very simple, but actually it is a very complex topic, because as a good teacher, he has made everything look very simple. And for me, after 60 years or so, refreshing my memory of cardiac heart So anatomy, particularly physiology, I knew that this one. So wonderful listening to you. I hope you also have a lecture tomorrow.
Day after
Yeah.
tomorrow, sir.
Not
29th.
tomorrow,
Day after tomorrow, day after tomorrow.
a day after
29th, sir.
tomorrow. Okay, I'll be happy to listen to you again. Thank you very much.
Thank you, sir.
Dr. Suresh sir,
Sir.
again, thank you very much. Students do not have any questions. Most probably Professor Saidapur sir asked what they should have asked. So thank you very much on behalf of PSTA. We'll be happy to listen to you on 29th, day after tomorrow again on pathology and other things. At that time, probably there will be more questions.
Okay, sir.
Very much.
Thank you, sir.
Thank you.
I also thank all the attendees who have joined on both the Cisco FX and YouTube platform. If you have any questions for today's talk, you can ask on 29th also. So you prepare well and come. For doctor, with all his busy schedule, has been very kind enough to join and deliver this talk. We should be, we should take home a lot of message from his talk. Thank you very much. Good day. Thank you, sir.
Thank you, sir. Thank you very much.